All right. Hi, everyone. Thanks so much for joining. My name is Debbie, and I am from the DePaul Career Center from the Healthcare and Science Career Community. And thanks so much for coming to Industry Insights and Healthcare Startups with Matter Health. Industry Insights is designed to introduce you to different industries within the kind of wide range of healthcare and science, and hopefully to introduce you to some new companies and new industries that you might not have heard of. And before we get started, I just wanted to very briefly share a couple of Career Center resources, just in case. So this is our Career Center main website, lots of useful links from our homepage. And then we also have our career advising, and this is how you can make an appointment to meet with a career advisor or career ambassador. You can schedule a virtual appointment either via Zoom or by phone. We also have drop-in coaching, and if you just want to get some feedback on your resume via email, we can also do that as well. We also have and I'll put some links in the chat after this in a second too. We also have a career library where we have over 50 different resources, usually in a 1 or 2 page PDF, along with a number of videos. We have career library resources on things like resumes and cover letters, interviewing, job searching, networking, salary negotiation, and more. And then just a couple other events that we have coming up. This week on Thursday, we have, let's see if I can open the preview. We have our event, how I got this job, where an alum is going to talk about her position as a research biologist at the U.S. Army Corps of Engineers. She studied environmental science here at DePaul. We also have our Summer Internship Fest next week to help you prepare for your summer internship search. And then also coming up in a couple weeks, we have a Kahoot Trivia Night on February 9th, and we're looking forward to that. So again, I'm going to stop and I'll add some links in the chat, and I'm going to turn it over to Claudia and Lashante and Nick, our colleagues from Matter. They'll talk a little bit about what Matter is and give you some more information. If we'll have time for a Q&A, and I know we have a small group, but if you have questions, feel free to send them in the chat. You can ask them, or if you want to send them just to me, I'd be happy to ask on your behalf.
All right. Well, Debbie, thank you again for letting Lashante, Nick, and I come and speak to the DePaul students and give a little bit more insight into what it's like to work at Matter, specifically what it's like to work at a healthcare startup. So we just want to start off by doing a very high-level overview of what Matter is. Lashante, if you want to go to the next slide. And so Matter was founded in 2015 as a result of an initiative set by the city of Chicago to increase collaboration across different stakeholders in healthcare. And by stakeholder, we mean those who are on the ground inventing, really pushing forward to try and create these innovations for healthcare. Those working within hospital systems and payers like Blue Cross Blue Shield or OSF. So really helping make sure that all these different players and actors within healthcare are able to communicate, because what we noticed in the past was that there really was just no cross communication across all these different stakeholders. And so we have a nonprofit, no equity model, which means that we don't have any financial stake within our companies. So really our sole purpose is to make sure that the startups that we work with, the corporations that we work with, are really able to fulfill this goal of communication and helping increase innovation across the healthcare sector. And so what we do is categorized into 3 different sections. So we are a startup incubator, a community nexus, and a corporate innovation accelerator. And we'll go more into detail about what all that exactly means. But we're really fueled by our mission, which is to help people and organizations transform ideas into solutions that improve the healthcare experience. And so is really what motivates Lashante and Nick and I to kind of show up every single day. And this is what also we see motivates the startups that we work with. They have these really big, bold ideas to solve problems that they see every single day within healthcare. And it's our job to make sure that they're able to make these solutions, have these solutions reach a broader audience. And so by way of introduction, my name is Claudia. I am the Venture Acceleration Coordinator at Matter. What that means is I do data management for our venture team. Our venture team is the team that specifically works more hands-on with our startups to try and solve any problems that they may be facing, trying to connect them to different mentors that we have within our network. So I do data management and manage a few of our mentor programs, like our mentor clinic, which we'll go into a bit more detail about what that is later on. And to talk a little bit more about my past experience before being at Matter, I actually recently graduated from Northwestern last year. I got my major in psychology and global health, and what really prepared me for this role was the internships that I had beforehand. So I previously interned at a startup called Regroup, which is a telepsychiatry startup, and it really exposed me to the very hands-on way that startups tend to work. And it was through that internship that I realized that I really want to get involved in this very unique sector within healthcare, trying to learn how startups actually implement innovations. And through Northwestern, I was able to intern at Matter and get a little bit more exposure into the different ways in which different members of the team worked to try and help these startups. And through that internship, was lucky enough to be able to then transform that internship to a full-time position at Matter. So that's what led me to here. What it's like to work at Matter at a startup. It's very, very hands-on, regardless of what your role is or what you're expected to do. Every single day kind of looks different, which is crazy to be able to say that even in this virtual setting, that every single day there's something different that's going on, but that's definitely the truth. You get so much exposure into working and being involved in different projects that you may have necessarily never thought you would be involved in as an entry level position.
Great. And my name is Lashante. So I also work with Claudia on the Venture Acceleration team as a Venture Acceleration Associate. And so my role is that I work with all of the startup companies that are coming into Matter, and I help recruit them, tell them all the amazing things that Matter can offer, and coordinate with them while they are a Matter member to make sure that they are using our resources to the best of their ability. My route to get to Matter, I'm actually from Washington State, and so I went to undergrad here, a small school called Gonzaga, and I studied biochemistry. And I really was interested in healthcare at the time, but I knew I didn't want to be a doctor, I didn't want to be a vet, all those other options, but I knew what I didn't want to do, but I didn't know what I wanted. And so I thought grad school would be a great place to figure that out. And so I ended up going to a graduate program at the University of Notre Dame called ESTEAM, where I studied entrepreneurship and technology. And really, all of us had some sort of science background, whether it was engineering or biochemistry or biology, and we really learned how do we take a new concept in the health or sciences field and get it in the hands of people. And so that's where I really dove deep into startups and dove deep into entrepreneurship and ended up loving it and thinking it was going to be a really great path for me. And so I graduated in May of 2020 and ended up at Matter in November. So it was a bit of a rocky road with a pandemic going on, but I'm really happy to be here. This has been a really cool experience to be able to dive into startups in a deeper level on an everyday basis. And just like Claudia said, every day is different. And we're always talking to new companies and figuring out what are the new trends and in healthcare and how can we stay on top of that.
Yeah, thanks, Lashante. My name is Nick Morales. I am the operations associate with Matter, a different department than both Claudia and Lashante. I'm more focused on everything that goes on in the space. Pre-pandemic, I sort of self-dubbed myself the Superman of the space, just because I was the one to really put out fires or be that first point of contact for everyone that came into the space. And if I knew an answer to your question, I would definitely answer it. If I didn't know the answer, I would direct you to someone who does. So I was sort of that front face of Matter when things were normal. I guess moving to the pandemic, I've sort of focused on a tech focus, sort of be that systems admin for the entire host of systems that we have at Matter, as well as sort of have a auxiliary support with membership and I guess the billing strategy with Matter and its member startups. My background is actually, I graduated from Loyola with a bachelor's in healthcare administration. A cool thing about it is that, I wanted to say that I wanted to appreciate more of the tech side of healthcare. I had a more conventional background of, knowing more about healthcare administration and hospitals, workforce environment and stuff like that, but never really anything in the tech side and the innovation side of healthcare. So this was my first job out of college. I've been with Matter since I graduated in 2018. And it really opened my eyes to everything that I haven't learned or I haven't really attuned to back then. It was a really unique perspective since I was unaware of this whole section of healthcare, and I'm glad I made that step to really supply to Matter from there. But yeah, that's essentially what I do as a whole in my background. I've been here for at least I guess a third of the time that Matter has been sort of a thing since 2015. So yeah, that's me in a nutshell.
So Claudia briefly mentioned our model, and I think it's important just to kind of see it visually. So Matter works in 3 very distinct separate ways. And the first one is Startup Incubator. And so an incubator is kind of it's a fancy term for really nurturing and growing startups so that they can scale and so that they can eventually if they're selling a product, it can eventually be a product that a lot of people are using, or if it's a service that a lot of people are using. So it can really grow and actually become something that that's more of a business rather than like a startup and an idea. So we work with those entrepreneurs and give them all of the tools and knowledge necessary to grow. Secondly, we work as a community nexus. And so part of those tools that we give our startups is a community. I think it's so important to the structure of Matter to be able to connect people to the right resources, and whether that's with other CEOs of smaller companies who are going through similar struggles, or if people are working in the senior living space and they found that something works better than the others, we can connect to them and really open up that discussion. And so it's a really great place for entrepreneurs to kind of be a sounding board for others and just really connect and learn from each other, as well as with our corporate partners. And so these are the larger, big named industries and businesses that we would all know today, like Blue Cross Blue Shield or big pharmaceutical companies or even universities. And so we also grow a community on that end, which kind of leads us really nicely into what we call our Corporate Innovation Accelerator. And so an accelerator is something that can help push ideas along. And so we work with our corporate partners to be able to stay on top of the trends and to be able to really push their new ideas and their innovation teams, so that these larger companies can still grow and change and think about what's new and up and coming. So to dive a little bit deeper into each of these, our Corporate Innovation Accelerator, like I mentioned, is with our corporate side. And so Nick is from our operations side, Claudia and I are from ventures, but we also have another team at Matter called Partnerships. And so our partnership team is very important to us. Since Matter is a nonprofit, this is where a lot of our revenue comes from. And we actually the partnerships team works with our corporate partners on an everyday basis and are always communicating with them. And they look like companies like this. So hopefully some of these are familiar to you. Blue Cross Blue Shield is on there, Baycare, CVS Health, we work with Northwestern in a lot of different ways to allow for those partnerships to grow. Our partnerships team is communicating what Matter does, is communicating how our startups can help these corporate partners, or how these new ideas can bring about new innovations. For example, we had a partner 2 weeks ago reach out to our partnerships team and say, hey, we just got COVID-19 vaccines and we're really interested on how to deploy these out and get them out to people. Do you have a partner who's doing that already? Can we communicate with them and talk about their deployment strategy? And so our partnerships team connected 2 of our partners so that they could then find the best strategy and the best route to give COVID-19 vaccines. And so that's a really cool side of Matter that is very important to who we are.
And then this other piece to Matter is this community nexus. This community looked a little bit different pre-COVID than it does now. Pre-COVID, our Matter space was really a perfect opportunity for our startups, our partners, really anyone to come into the space and just strike up a conversation. We have this large open working space where people are able to work with one another and really just strike up a conversation about how is your venture going? How's your venture going? Have you met with this partner yet? Do you have any tips? Really trying to foster that open communication. And what we've done now is try and be able to create that community virtually. And we've gone about this way in creating CEO forums. So creating spaces for CEOs with very niche technologies, for example, health equity, and having them meet once a month by themselves to kind of imitate that natural communication style, just asking questions of where one another are at and if one another has any feedback or advice on how to get on where they are. And during this portion, I wanted to talk about 2 other departments that we work with. One is the operations team and one is the marketing and events team. Our marketing and events team really works with trying to curate events that might be interesting not only for our members, but for the public as well. So we have a few different styles of events. We have workshops that are geared particularly for members to be involved in. We have Tales from the Trenches, where we have keynote speakers come in and speak to a very specific topic within healthcare. The marketing and events team both deals with that, but also deals with representing our Matter brand and who we are and making sure that people know that Matter is a space for healthcare innovation and a space where these kind of innovative ideas can really grow and accelerate. And our operations team, Nick, definitely feel free to chime in at this point, but is kind of the team where if you have a specific question, but you don't know who to talk to, you go to them. Not only do they help manage our space, but they really help manage our members in being able to serve as the first initial point of contact and a friendly face, so to speak, even though we're very virtual for our members as well.
So lastly, our third pillar, our startup incubator. So I just kind of already explained a little bit about what an incubator does, but just to recap, I was trying to explain what an incubator is to my family that doesn't understand a lot about startups, and they were like, well, you incubate ideas, and I was like, yes, that's really what it is this you get an idea and you really try to grow it and it give it as much as it needs to become something that's more than just an idea. And so our companies that have been a part of Matter, one of the ways we do that is through investments. And so we get venture capital or a lot of different types of investors who want to put money into these new ideas so that they can become something more. And so our companies have raised over $1 billion. Over 100 million patients have benefited from what these really cool and innovative ideas that our Matter members come up with. And they've accumulated over $160 million of revenue in 2019. And so these numbers are, sometimes it's hard to really visualize this, but it's a good way to know that what we're doing is working, and it's a really cool opportunity for Matter startups to get into this space because we have great outcomes. But to get there, there's a lot of work behind that. And so our Matter workshops are really important for our startups if someone's very early stage. And by that, I mean, haven't necessarily gained a lot of revenue or don't have the customers that they need to grow. We can give them a lot of knowledge on how do you reach those customers? How do you build a marketing strategy? And that all comes from our Matter workshops that are all virtual right now. Our expert clinic and our mentors are also very important to us. So these are experts and industry executives who volunteer their time to help Matter startups. And so this is a really cool goal of maybe employees of Matter as well, as to be able to be a mentor in the future, to be able to have all this entrepreneurship experience and to be able to be an expert in something is a really cool aspiration. And to be able to communicate with everyone, oh, well, I tried this and it didn't work, so I would recommend something like this. And that's really what a lot of those one-on-one sessions and feedback looks like.
Great. And what we also do is try and help these startups reach customers and investors through a wide array of different programs. So one of them is our Access program, where we will have our strategic partners, so the Blue Cross Blue Shield, the OSF systems that we work with, will come to us and say, hey, I'm really trying to get smart about patient advocacy. Do you have any startups that I can meet with to pick their brain or possibly try and pilot their designs? And so what we'll do is set up those strategic partners with members that fit that specific niche to try and increase that communication and help our members be able to reach these customers. We have pitch practices where we have our members go through a practice pitch and present to a panel of judges to be able to get feedback on how to best communicate their ideas to potential investors so that the investor sees the value in their product and knows whether or not to go ahead and invest in them. We have forums, roundtables. Our venture acceleration team, Lashante, and I work with another member of our team, Courtney, to go ahead and facilitate these types of events. And we're in the process of building out an investor outreach support. So building out a very specific investor network where we know who to connect our members to try and get access to fundraising and investors. So with that, that is a very high level overview of Matter, who we are, how we got here. If you have any questions at all, please feel free. But thank you all.
I'm curious if you could talk about, I know you were talking about creating this investor network, but are there any directions or any new projects or new things that you're excited about or something that you would like to see happen in the next couple of years at Matter?
That is a great question. Something that we're currently working on, or I recently just started working on, Lashante definitely speak to this as well, but we just recently launched our Bridge program, which is essentially just a free mentorship opportunity for underrepresented founders and aspiring founders to just be able to tap into our mentoring networks that we have at no cost. This is something that in the upcoming years, we're really hoping to stabilize to make sure that it's not just a one-off mentorship opportunity, but rather this is something that people can come to our website, be able to learn more information about and be more involved in. So that's what the hope is for 2021 with that program that we just launched.
Perfect. Lashante, it looks like we can do the tour right now. I can share my screen if you want to.
Okay.
Real quick. All right, so just going to give you guys a virtual tour. It'll only take 10, 15 minutes from here. Then we can open it up to any questions you may have just right after. But yeah, let's get started. So welcome to the tour. This is, keep in mind, this is the space as it is, or as it has been before the pandemic. So once we conduct regular operations again, once it's safe to go back into the space, feel free to come by. We're more than happy to welcome you into the space, and I can give you probably a physical tour if you're interested. So yeah.
I have to say I went to the space but in February and it is really cool. It's like being in the future. So I highly recommend visiting.
Yeah, I like to use the colloquial term on my tours when I'm in there. We're sort of the Silicon Valley of the Midwest, sort of, just because our neighbors 1871 to down the hallway are sort of focused on more general tech startups while we were healthcare startups. So kind of has that holistic view just on the 12th floor of the merchandise mart. But yeah, it's a really cool space. So moving on, this is motion heavy, by the way. If anyone is just averse to just motion moving forward, feel free to, just I guess look away from the screen, but just want a heads up there. So going into the space, this is what you'll see in the front doors. You'll see that our logo is actually just a composite of the stacked letters of Matter on a 3D plane. This is behind the help desk. This is sort of our credo and the core of what we do at Matter as a whole. Sort of, what we do from day to day that really contributes to that. This one space is one of the shared spaces you'll see in the office. Many places that you can work on from day to day. None of it's assigned seating, so you are able to work there as well. I'll talk about this later on, but this is what Claudia was speaking about in our event space with the Tales from the Trenches and pitch practices that we hold. We're walking into sort of the casual area here, sort of our shared space where you can talk to investors, other companies, partners, as well as just have a chit chat, kick your feet back, even have some lunch over here to really just take a break from all the work and stress that it may have. So coming up to the right is our shop. If you have a physical product, you can work on that there, as well as our specialty room, the AMA Interaction Studio, which I'll talk about right after this. So coming up on the left is our shared Chicago space. Essentially just how, where you could work if you're a member, partner, university student, or anybody that's still part of the larger Matter community can work out pretty much every day. You'll see the blue doors over there. They are our conference rooms, which I'll speak about more in depth later on. Moving on to our specialty rooms. Let's see, perfect. The first one I have in mind is the OSF simulation stage before I move on. The other one is the AMA Interaction Studio. The cool thing about those two is that they sort of mirror each other in a sense that the OSF simulation stage is more an inpatient feel, sort of that hospital bay. Going to the AMA Interaction Studio, it's more of an outpatient experience. So more of your doctor's office type of feel. So let me go into the OSF. So just behind our help desk is the simulation stage. It is an exact one-to-one replica of a hospital bay, even down to the luminescence. So everything here was donated by Hillrom, especially the Hillrom Technologies, all from the little doctor's office gadgets over here, as well as the more focus on the clinical space gadgets here too. So this was more of a space for member startup companies to pitch to investors. So say that you have a clinically based product, want to use it in the hospital. You can pitch to the investors right here, and it's a little gem in the middle of the merchandise mart that you wouldn't expect. Hospital bay in a very business tech heavy place. So little sight to see. It is also a way for OSF based down in Peoria to hold their jump simulations, sort of a proprietary simulation that they've held where doctors can pretty much go through the motions of certain procedures and, on like medical dummies and stuff, and dial in to OSF's network and say, hey, you're doing this right, you're doing this wrong. This is what you need to do. And they can adjust accordingly on that webcam that you saw on top of the TV over there. So cool way for the OSF people to have offsites as well. So going on to the AMA Interaction Studio, this was our former home to our mentor clinics, as Claudia and Lashante were referring to. If you were more based in the Chicago environment and so was the mentor, this is where you would really speak about stuff. So say that you want to know about HIPAA compliance and there's a mentor that can really speak to that. You have sort of this office hours type of feel for 30 minutes where you could speak to them, really get to know the specifics about it and just chat about that as well. Like I said, this is more of an outpatient type of feel. You'll see the doctor's chair there and a little bit of the machines at play, and also that conference television. So if you're not based in Chicago or the mentor's not based in Chicago, you could actually dial in from there. But yeah, it's just sort of those two rooms of that outpatient feel and that mentor clinic home that really tie this interaction studio together. So then we're going to move on to the common areas. Does anybody have any questions so far? I know I'm speaking at a quick pace. All good. Okay, perfect. So what I want to call out in particular is our shared Chicago space. You'll see it right here. This is pretty much unassigned seating. And it was more of that open concept to foster collaboration between all sections of the Matter community. So say that you're a startup member and you're luckily sitting next to someone that is on one side, a person on your team, and then on the other side is like a corporate partner. You didn't even know that, but you happen to be sitting right next to them, speaking about something, how you want to integrate to hospitals EHR for tests and everything, or research. And this partner to your right says, oh yeah, I work in so-and-so hospital. I can really set you up for things. And he just overheard you and was actually really excited about the conversation and just happened to jump in. That's sort of the conversations that we want to foster at Matter, sort of that collaboration. Even casual conversation can spark and ignite so many different opportunities. So yeah, it's when we were back in the office, it was the entire Matter team used to work out of here, a lot of our startups, as well as the corporate partners, as well as some university students through those partners. So that whole host environment of collaboration was just amazing to see at work. So going on to the conference rooms, just a little bit on that. Each conference room is standard with a Polycom conference telephone, HDMI connectivity to that HD TV you see up there, as well as webcams for more of that virtual presence, as well as to the left of this room, a whiteboard wall. So very standard stuff. The cool thing I liked is the whiteboard wall being sort of spanning the entire wall, and also sort of more casual environments like this room itself. So there's a sort of more diverse selection of conference rooms at Matter, whether it be extremely formal to your board meetings, to your strategic imperative meetings and sit downs, to more of a chit chat whiteboarding session with the rest of your company. Matter can host that. So I'm going to go to the event space and sort of talk more about our signature events as well. The first one being our auditorium space. This is more of where our flagship events were held. Upwards up to 200 people were in this space at the time. It's a weird number to think about now, but at the time it was very fitting. And the first one I want to call it is Tales from the Trenches. This type of event was where very prominent figures in healthcare were able to talk about how they came from the trenches and built their way up to the top to today. It's more of a moderated fireside chat. So we do have a moderator that actually has social QA, an app where you can ask questions from the audience. And the moderator would actually read them out to the person they were talking to, and really guide that conversation there. One of the previous speakers was actually Charlie Mills, CEO of Medline. So, if a lot of these figures are always happy to speak about where they have come from and inspire the rest of the forefront of innovation in healthcare. So, and then the last slide we have is just where our classroom is. Think about, college seminar, 90 minutes, speak about a certain topic in, healthcare. Say that you really want to hear about HIPAA compliance, but you are not really well versed in it. You just want to know the general feel of it. Those kind of seminars really happen as workshops at Matter. back in the day, we used to have them both physical and virtual. So it would occur in the classroom. You have your classroom style seating here. People would attend it in the office, but also have an option to dial in if you're not from the Chicagoland area. So you'll see cameras to the left and to the right over there to really facilitate that virtual presence so that none of the people in the Matter community were left out if they wanted to join. But yeah, that is essentially the entire Matter space in probably around 10 minutes. Does anybody have any questions for the space or even for Lashante and Claudia and I? If not, all good. We can hand it back to you, Debbie, just in case that you want to take it away.
Yeah, I think similarly, just what questions do you have for any of our Matter colleagues? I'm curious to know what your favorite parts of the Matter space are.
So I'm currently a freshman at DePaul in public health with a concentration in public health, and I just wanted to explore more areas of the healthcare field because I was in the biosciences last quarter, but then I just thought about it more and I did not like the actual doctor side of it. I wanted to be more in administration side, and so this was definitely more enticing to me just because it still has to do with healthcare but not heavy doctor stuff. So I know that y'all do more business stuff now because I was really curious about this because it was more administration. But in terms of public health, what else could there be, or if anything? That's just my question.
Yeah, that's a great question. We're currently in the process of trying to incorporate a lot more public health concepts into the events that we have. So looking forward to 2021, we're creating a health equity series where over the course of the year or two, we're going to have each month, we're going to have different speakers to speak to different topics within health equity. So it's in these events that we're trying to incorporate a little bit more of a public health aspect to it. I think every single day, almost when we talk to our members, we're dealing with some sort of healthcare concept, healthcare technology, healthcare gap, trying to work with members who, I'm thinking one called telehealth, where they have not telepsychiatry, but are trying to increase access to physicians by having people use telemedicine so that people in rural areas are able to access doctors where they otherwise may not be able to have access to them. So it isn't so overt public health. However, every single day there are these little instances where you're constantly dealing with these kind of subject matters.
Yeah, speaking on that too, actually, I forgot to mention that I also held a public health internship with Loyola's hospital out in Maywood. A lot of the things that Claudia said, I'm echoing off of that, but going with socioeconomic factors in healthcare, access to healthcare, and everything of the like, it does come up in bits and pieces in a lot of what Matter does. In 2021, we're trying to focus that to be more of the main stage of things, and that's sort of what I like. That it's integrated in a lot of people's startups, but focusing that on the main stage is just the thing that's on the up and coming for a lot of public health people, a lot of innovators, and everything in the healthcare space. So,
Thank you.
Yeah. Any other questions? Also, Frida, I know that there's an internship program at Matter, and I saw that it's still open for this summer or for a future summer. That's definitely something to look into to get that experience in healthcare and in healthcare startups, and to check out all the different options.
Yeah, definitely, I can speak to that real quick. We do have an internship program. It is a 10-week program here at Matter, focusing on virtual at the moment, just for the current state of the world. But yeah, it is a way for you to really integrate into just the Matter team and get that holistic view of the program, whether it be work with the ventures team like Claudia and Lashante here, or even the partnerships team, operations, or anything of the like. You sort of get the wide gamut of things. So it's a cool thing. I saw that, Debbie, you did paste the link over there if you want to apply and are interested. So for the people, you know, who do want to apply, it's also on matter.health/careers. So.
Thank you. I'll definitely look more into that.
Anything else? All right. Well, thank you so much, Claudia and Lashante and Nick, for sharing your experiences, for talking about your backgrounds and how you came to Matter and talking about what you do and explaining more about the different parts of Matter and the teams and showing us the space. It's a really great partnership that we have between our two organizations, and I look forward to continuing to work with you all. And thanks for joining us.
No problem. Thank you.
Thanks for having us.
Of course.
Thank you.
Thank you.